Hi there, my name is Mary Rose Coker, and I'm an English teacher at Plano High School. This is a consultant's challenge with a focus on behavioral disorders of autism and ADHD. Welcome. Due to the ever increasing numbers in students with behavioral and learning disabilities in the school system, this educational reality requires researching and then implementing new strategies for coping with these increasing numbers. This new educational reality presents a necessity for finding sufficient information in order to gain an understanding of these behaviors, and then to implement the appropriate strategies and modifications in order to ensure academic and social success for all of our students. As an appointed consultant for the district, I was advised to identify behavior problems and prevention modification strategies for the specific behavior disorders of autism and ADHD. With steadfast determination to find useful information, extensive research has been compiled in efforts to find the appropriate information to help our district properly to support all of our students. Every child is entitled to be given the opportunities to succeed academically in the public school system. Plano Community Unit School District is fully aware of the educational realities in education, making it our mission to find and implement the appropriate opportunities for all of our students to succeed. Let's get started. Means of identifying students for autism and children with ADHD. What was once considered to be an extremely rare diagnosis, the prevalence of autism has increased rapidly over the past decade. In fact, the National Autism Association states that autism affects 1 in 68 children. Autism is considered to be the fastest growing developmental disorder. This disorder is treatable with early intervention. Autism is defined as a neurodevelopmental disorder which is characterized by social impairments, cognitive impairments, communication difficulties, and repetitive behaviors. It is characterized as a spectrum disorder, which means it encompasses a set of characteristics that range in severity. Children who display only a few characteristics of autism are considered to be on the mild end of the spectrum, while children who display many of the characteristics are considered to be at the severe end. For ADHD, the CDC states that ADHD is one of the most common neurodevelopmental disorder of children. ADHD is characterized by developmentally inappropriate difficulties with attention, impulsivity, and hyperactivity. The main symptoms of ADHD are often accompanied by other behavioral problems such as aggression, noncompliance, and anxiety, which leads to the identification of the root causes of the behavioral disorders of autism and ADHD. Autism is not caused by vaccinations. I know that's really popular in the news, but scientists have stated that it is not caused by vaccinations. There is no known singular cause for autism. It is, though, generally accepted that could be caused by abnormalities in the brain structure or brain function. Brain scans do show differences in the shapes and the structures of the brain in children with autism. There is new research to suggest that there is a genetic component to autism. For example, if you have identical twins and one twin has autism, it is more than likely that the other twin will eventually show some signs for autism as well. Moving on to ADHD for the root causes, studies are indicating that genetics also play a factor when considering ADHD. Typically, if you have a member in your family that has ADHD, the prevalence of that diagnosis will become rampant throughout your family. ADHD is caused by chemical, structural, and connectivity differences in the brain. Behavior modifications and strategies. For autism, physical environments should communicate behavior expectations, schedules, and transitions. For example, I will put my schedule up on the board step by step to help the children that I have in the room know where we're going, what we're doing, and where we need to be. Schedules are always passed out to my students in advance so they know what to expect in the days and weeks ahead. Also, I try to identify transitions by stating, okay, we just did this, next we're going to do this. Materials and areas should also be labeled to help students communicate and identify what they need. A quiet area should be given in the room for children with autism. When the environment becomes too overwhelming for them, we are going to try to teach our children with autism to accommodate for themselves, go to that quiet place, and calm themselves down. Also, physical cues are very helpful for children diagnosed with autism to help them know when it is socially acceptable to get up, to move around the room, and so on. There's also positive behavioral supports, which is a three-tiered system. Positive behavioral supports has been known over the course of recent years to be an effective practice for reducing challenging behaviors in children with a variety of disabilities, including autism. The goal of positive behavior interventions, or PBS, for students with autism is to prevent and then reduce the occurrence of interfering behaviors. An example of that would be repetitive or disruptive behaviors, ones that inhibit learning. The primary goal of positive behavioral supports is to improve the quality of life for students by increasing their appropriate behaviors and adjusting the environment around them to prevent interfering behaviors. When using PBS, a tiered intervention model is used to increase the positive behavior by gradually applying a more focused support and intervention at each level. There is a focus for ensuring positive relationships through the team building and family involvement at each intervention tier, which is what is fabulous about this PBS three-tiered system. It's just not the school environment that's involved, it's also the family environment of the child as well. However, it is important to note that no two children with autism are going to exhibit the same symptoms. So because this is a spectrum disorder, you really need to know the child as an individual before you make modification plans and strategies. Moving on to ADHD for modifications and strategies. Children with ADHD should have preferred seating within the classroom. Typically, they need to be in the front of the room by the teacher, which is also away from windows, doors, and distractions. They need a seat in which that they can focus. Some behavioral interventions include having the rules posted within close proximity and that they're clearly stated and they're extremely concise. Also, reduce task commands for children with ADHD by modifying the length and content on homework assignments and assessments. Also, during class time, provide these children with choices so they can work through how they learn best, and they can take ownership for their learning because they're making the choice. Also, children with ADHD, due to their impulsivity, they do need to understand consequences for each choice and behavior that they make. Also, give them positive reinforcement when the behavior that they choose is acceptable. To conclude, every child that is diagnosed with autism and ADHD is different, and we as educators need to treat all students as individuals and appropriately accommodate their modification plans and strategies to best suit their individual needs. The new reality in education, in which the members of the students with behavioral and learning disabilities are rapidly increasing, it is imperative that the Plano Community Unit School District is prepared to appropriately accommodate and acclimate all students. Every child that is diagnosed with any learning or behavioral disability should be treated on an individual basis. And also, keeping the lines of communication open among colleagues as well as family members is also critical as well. Every child is entitled to an education, and every child in the Plano Community Unit School District will be given the opportunities to succeed academically and socially. Thank you very much for your time.